Good afternoon, everyone. It's great to be at Wellington Regional Hospital today, where we are able to confirm a new investment in expanding the emergency department of this hospital, as well as refurbishing and upgrading other wards and clinical spaces. This is part of our $1 billion investment in health infrastructure in this budget, which shows the priority that the government is placing on New Zealanders' healthcare. The Minister of Health has put a lot of work into a health infrastructure plan, which has allowed us to look across the country to understand what the needs are in our many medical facilities and then prioritise those projects accordingly. This project is a priority because clinical care requires that there is more space in this hospital, and so we're pleased to have prioritised it. We're building on investment that's already occurring in the hospital, putting another more than $100 million on top of what is already here to ensure that this work can progress at pace and in a well-sequenced way. So with that, I'll hand over to the Minister of Health.
Well, thank you so much, Nicola, and it's great to be here with you all in Wellington at this very busy Wellington Hospital, as you can see. And today I want to share more detail about what this project will deliver and what it means for the people of Wellington and the wider region. This is a significant investment in emergency and acute care for our capital city that will see an additional 126 beds and treatment spaces at Wellington Regional Hospital. Wellington ED is currently one of the poorest performing EDs in the country. Outdated infrastructure, cramped conditions and inefficient layout are contributing to long wait times, which is not acceptable, and the government is taking action. This redevelopment will add 34 new treatment spaces in the emergency department, increasing capacity from 53 to 87. That means less crowding, shorter wait times and faster access to care, and an ED that supports our hard-working frontline health workers. We're also delivering 36 new inpatient beds to ease pressure on admissions and improve patient flow, and 36 new outpatient consult and treatment spaces, improving access to follow-up care and supporting early intervention and faster recovery. But this investment doesn't stop there. We're also upgrading critical parts of the wider hospital, including refurbishing the historic old children's hospital to create a modern, functional space, expanding the intensive care unit with 4 new beds, extending the short-stay medical and surgical assessment and planning units with 16 additional spaces, and fitting out refurbished floors in the clinical services block. Construction of the main ED redevelopment will begin in 2026. The ICU expansion is expected to be completed in 2027. And the new emergency department is set to be fully operational by 2029. We're investing more in health than ever before. 1 in every 5 taxpayers' dollars now goes into healthcare, and improving our hospitals is a key part of our commitment to delivering high-quality, accessible healthcare for all New Zealanders. This investment in Wellington Hospital is a critical part of that goal. It's a commitment to the people of this region and a clear signal that we're serious about delivering better healthcare and better outcomes for all. And with that, we're happy to take questions.
Minister Brown, on the nurses bonding scheme that National campaigned on, is your government committed to implementing that?
Oh, look, as I announced a few weeks ago, Health New Zealand has invested significantly more into the nurse bonding that it currently operates and runs to assist with making sure we are able to bond nurses into our healthcare system. As part of the budget, we also funded up to 400 spaces for nurses to be able to start their careers in primary care, with $15,000 payments for nurses starting in primary practices in urban environments and $20,000 payments for practices in rural environments to help encourage and support those nurses into those practices. So we're doing a lot to invest in more nurses, both in acute, both in hospitals and in primary care.
So has any work been done on your scheme?
Well, the bonding system is something that we've continued to invest in. In fact, the amount of money that's gone into it, I think, or the amount of people who've received bonded payments from that is twice what it was in the previous year. And also the increased funding in this budget to support primary nurses into primary care is something which is new and a significant investment into primary care.
So if you parked your own scheme, do you agree with criticism at the time that it wasn't going to be as effective?
Oh, look, we've invested significantly, as I've said. We've doubled the number of nurses, or the number of frontline health workers who are receiving bonded placements through that scheme. We've also opened up the new 400 per year spaces for nurses into primary care, which is new money going into that. So we're investing significantly. Look, there's 1,700 more nurses working at Health New Zealand today than there was back in 2023. So we're investing in frontline healthcare and those frontline health workers so that we can ensure all New Zealanders can have access to timely and quality healthcare.
So you're going to stick with
Minister Brown, I'm from Kaitiaki Nursing Journal. Great with that ED, I'm sure that the nurses will appreciate that. Is there any consideration to any other extra funding and resources we can give to them to do their work to meet the targets? Because that's a challenge a lot of the nurses I speak to say they face, having to just do more work without any extra funding support.
Well, as I said, there's 1,700 more nurses working at Health New Zealand now than there was back in 2023. We continue to invest record additional funding into Health New Zealand. I think it's a $1.34 billion uplift for Health New Zealand's baseline, which is a significant uplift to allow them to invest in the frontline workforce required to give New Zealanders the timely and quality access to healthcare that they need.
And for context, that operational funding uplift is more than 7% over what it's been, which even on a population basis is more than 6%. So we're ensuring that funding is going in at a far faster rate than population growth or inflation, and that's to reflect the fact that we want there to be resources committed to frontline healthcare.
This is technically a downgrade from what Aisha Viril announced by one bed for the ED. Why have you gone for 34 and not 35?
See, the difference between Aisha Viril's announcement and Simeon Brown's is that I'm standing alongside him having actually funded it. It's one thing to announce something, it's another thing to fund it.
But why have you gone one fewer?
Well, look, it's been a business case undertaken by Health New Zealand to deliver what's required here. And if that's what you're talking about, Lloyd, about one particular bed, what we're focused on is actually getting this delivered and for the people of Wellington. And this is a major upgrade for Wellington City and for this hospital to ensure that there is more capacity in the emergency department, more ICU spaces, more short stay spaces, so that we can actually get the patient flow. And the emergency department really is the beating heart of the hospital. But it's also about having that capacity around the emergency department so people can actually have places to go to once they've actually been diagnosed and received that treatment. So this is about the emergency department, but also about the hospital, so you can get the patient flow. One of the challenges at this hospital is not just the lack of spaces in the emergency department, but the lack of spaces outside the emergency department and the bed blockage, which is causing this to have the worst shorter stay emergency department wait time in the country. So that's why we're investing not just in the ED, but in the wider hospital to get that patient flow, get patients treated.
Yeah, and talking to the clinicians today, what they've been very thoughtful about is if we just expand the emergency room but we don't have more space elsewhere, that just moves the problem along. So they've been thoughtful about where they need new beds, where they need new capacity, and so this needs to be thought of as a full project and not just the emergency room.
Will you fund the people as well, the nurses and the doctors and stuff, to go with those beds? Or like you're going to give these guys who are here, you're going to give them money to get the staff?
Well, that's part of what Nicola's funded in this budget, and that's why in last year's budget we allocated over 3 years $16.68 billion over 3 budgets as an uplift to Health New Zealand to ensure that they can invest in the frontline resources. As I said earlier, 1,700 more nurses working at Health New Zealand today than there was in 2023, 200 more doctors working at Health New Zealand today than there was in 2023. We're not just investing in the infrastructure, we're investing in the people required so that they can give the quality and timely care that patients need when they turn up to these hospitals.
Health New Zealand can tell us if the staff are going to be resourced more with some of this funding to be able to meet the targets that have been set by the government.
Adam.
Just on wait times, you've acknowledged that that's one of the worst performers in the country. And you think if you're investing in it to upgrade it, there's an acknowledgement that there is some resource needed. So in terms of your target around wait times, are you considering, is there a grace period that you're going to be able to give this hospital with respect towards wait times, given that it's going through this upgrade?
Okay, our targets are very clear. We want that 95% of people turning up to EDs being seen within 6 hours by 2030. We have interim targets. I think it's 74% by the middle of this year, which Health New Zealand's working very hard to achieve. But our very clear focus, putting patients first. It's a very busy ED. Yeah, well, the milestones for across the country. Obviously, every single hospital has plans in place to improve their performance. There's a lot of work going on here to improve their performance. We're not satisfied with the amount of people who have to wait so long. We're not satisfied, so there's a lot of work going on. We've recently opened a high dependency unit which helps to facilitate more patients through this hospital. Health New Zealand's working to contract more spaces in aged care, so there's places for people to be able to go to if they to leave at the other end as well. So there's a lot of work going on now to improve the performance operationally, but what we're acknowledging is that there is a need for an upgrade of the infrastructure, which is critically important to meet that 95%.
So I suppose the question is, do you think it's possible that they can achieve what you want them to achieve?
Oh, we have high expectations. We acknowledge the challenges, though. We acknowledge it is possible to meet the milestone, but they have a lot of work to do.
You see that this is the worst performing ED in the country. You've had time with the staff here today. What's the most concerning story that they've told you about what they're facing?
Well, I think what we've seen is, it's an incredibly tight facility, not a lot of space. They're working in those conditions day in and day out, but these are professionals who work incredibly hard around the clock to make sure they're doing the best for patients.
Yeah.
And what we heard from them is that they enjoy what they do, but they know that there's a lot of challenges, and they're grateful for this investment that we're making. But we are committed to not only working to invest in the infrastructure, but also said the operational funding increase is important to support them.
Yeah, and I think it's clear that one of the reflections that the nurses have is that ideally they want to be able to treat patients in rooms.
Yes.
And with this expansion that will be more possible for more people, and that's really important. And I just reflect, I've been cared for here, my family have been cared for here. There are some outstanding doctors and nurses who give their very, very best, and I'm sure that they will continue to do that. And they've thought a lot about how they can make this refurbishment happen while also providing absolutely gold standard care.
Just on the Gisborne doctors' strike, 24-hour strike today, staff shortages pushing them to the brink of collapse. What's your response to that?
Look, Health New Zealand's doing a lot of work to recruit more senior doctors into Gisborne, and they are continuing to engage with the leadership there. The numbers fell substantially in 2023. The number of senior medical officers fell substantially in 2023. They have been increasing since. We acknowledge there's more work to do, but I just put it to the union, striking is not the solution. Striking simply delays care for patients and doesn't put patients first. And so I encourage the union to negotiate and work with Health New Zealand to solve these problems rather than striking.
Minister Willis, do you do your own social media?
Mostly, but sometimes I get some help.
Did you post that one last night where you said sometimes you think about dreaming about
It was actually a comment I made in a speech yesterday in Auckland, and the Auckland Business Chamber shared it on LinkedIn, and it was getting quite a reaction, so I put it up as a text post.
And is it true?
Yeah. Well, no, I do often have moments where I think about how much easier the government's job would be if we weren't showing fiscal restraint and we were just prepared to spend taxpayers' money with quite wild abandon. That would be easier because I would never have to say no. I could just say yes to everything. It would also be completely irresponsible because the job that we have to do is clean up New Zealand's books so that they're back in balance. We need to start bending the debt curve down, and we need to prevent a reality in which New Zealanders get slapped with a lot more taxes because the government's not controlling its own spending. So I accept the job that we're here to do. It's a privilege to be doing it, but I do have days where I think if there was just a magic money tree, everything would be easier. And I'm sure everyone here can agree with that.
The 7% increase in operational funding or budget overall.
Overall
How do you
budget.
get that? I mean, that's only if you take it from the starting point of what was budgeted versus what was actually spent. Does Health NZ really have a significant budget uplift?
Yes, and we're very happy to share you the workings on that data.
Minister Brown, just back on Gisborne, doctors say you've never visited the hospital despite months of calls for it. Will you commit?
I'm visiting next month.
What day?
I can come back to you, but I'm visiting next month. I think it's the 12th of June.
The New Zealand Nurses Organisation says there's a lack of action around assaults on staff going to and from work at Christchurch Hospital. Have you looked into this and what's your response?
Look, there's a lot of work Health New Zealand's doing to improve safety. We invested more money into security in hospitals up and down the country. You'll see that when you go to hospitals, and I encourage Health New Zealand to continue to work with the unions and with their staff to make sure that those staff are getting as much support as they need going to and fro work from work. Thank you very much.
Thank you.